Hello, I'm Dr. Alexander Stemmer. I'm co-chair of Symphony Care Network's COVID-19 Crisis Response Task Force. As a board-certified infectious disease expert, I work with Symphony's doctors and nurses to identify the best treatments and the most advanced methods for controlling the spread of COVID-19. Caring for patients suffering from communicable diseases has been my life's work. And after 40 years, it's hard to imagine a worse disease to afflict our sick and elderly than COVID-19. That's why we want our patients' families to know just how hard we're working to care for your loved ones to keep them safe. Today, I'd like to share with you 3 important steps we've taken to halt or slow the spread of this virus in our facilities. First is what we've done to limit our exposures to patient and staff. After monitoring reports out of China and CDC guidance, Symphony made the difficult but necessary decision in early March to restrict visitors at our sites. We only allow essential personnel on site, and we have mandated the use of personal protective equipment, PPE, for the staff. In addition, our staff disinfects high-touch surfaces 12 times a day. We're taking temperatures and vitals of our patients and staff multiple times during the day, and anyone who exhibits symptoms is isolated immediately. The second thing I want to share is our approach to treating our COVID-19 positive patients. Symphony physicians are adopting aggressive approaches to the treatment for positive patients. Rather than wait for the symptoms to progress, we are now administering earlier treatment of certain drug therapies to attack the virus. We're seeing better outcomes with this approach than was previously thought. We're sharing these discoveries through the task force so we can implement the best of what we're learning in real time. Third, and perhaps most important, Symphony has been an early advocate of universal testing. There is a severe shortage of testing across the country. Initially, our local and state public health authorities advised nursing homes to stop testing patients once a positive case was identified due to this shortage. But because we believe more testing is the key to putting a stop to the spread of COVID-19, Symphony has been advocating for universal testing in nursing homes. We have sought partnerships with the University of Chicago Medicine and called on assistance from National Guard to get better access to tests. Our executive team has also brought our own supplies from Abbott Labs and Alberta Laboratories. Testing is critical because the more you test, the more positives you will find. This allows us to isolate COVID-negative patients from positive to control the spread. We're thankful that the Illinois Department of Public Health heard our call and is now helping to supply tests for all long-term care facilities in Illinois, and we are making similar pushes in other states where Symphony has facilities. Those are just a few of the many ways we're working around the clock to combat this virus. We know you have put a sacred trust in us to keep your loved ones safe and well. We will be doing these video updates regularly so that you can hear straight from us what we're learning in the field and how we're adapting our care. In the meantime, we encourage you to submit questions by emailing us at covidresponse@symphonynetwork.com. We'll try to answer as many of your questions as we can in upcoming videos. In the meantime, here are a few questions I've received already. 1. What are you doing to ensure caregivers have enough personal protective equipment? All Symphony staff are provided PPE, and the facilities are continually ordering new supplies to ensure they have adequate provisions for staff. In fact, Symphony's Director of Procurement is entirely focused on securing new supply lines of PPE to ensure availability to all employees. 2. I've been calling to get an update on my family member at one of your facilities, but I don't always get timely reports. What are you doing to communicate with family? This is a great and important question. We know that it is an incredibly stressful time for families with loved ones in our care. While our doctors and nurses are heads down focused on doing everything they can to treat positive patients and to keep negative patients safe, we know you want to receive as much information about your family members' well-being. If you are not getting the information you need about your family member's health status, please ask to speak with the attending physician. They can keep you apprised of any concerns you may have. 3. When do you think there will be a vaccine for COVID-19? While a definitive treatment for COVID-19 is a ways off until a vaccine is developed, we're learning more and more about effective treatments in the field every day, such as early drug treatments. One of the ways that Symphony is exploring how it can play a part in the solution is by exploring working with the National Institute for Health on a new antibody therapy that will help prevent the spread of COVID-19. That's all for today. I encourage all of you to submit questions and let us know what's on your mind. We want to assure you that your loved one's health is our top priority. Thank you.